Good afternoon, everyone, and welcome to the second webinar in our 2020 Leading with Evidence series. Today, we will be discussing the use of a newly developed tool to guide fiscal planning when considering the use of Family First Prevention Services. I'm Suzanne Barnard, the Director of Evidence-Based Practice at the Annie E. Casey Foundation. I will serve as your moderator today. The Annie E. Casey Foundation is in the 5th year of delivering the Leading with Evidence series of convenings and webinars. We would also like to acknowledge the many contributions of the William T. Grant Foundation to this series. Our aim is to offer practitioners and researchers ways to immediately apply programs and practices to better deliver and strengthen the utility of your work. I would also like to acknowledge that in these extraordinary times, so many of our colleagues, while facing huge challenges, continue to make heroic efforts to meet the needs of children and families. I want to extend our deepest appreciation to all of you, stepping up to mobilize resources and increase protections for others, all the while putting yourselves on the line in service of others. Today's webinar will focus on helping child welfare system leaders use a newly developed fiscal tool to help in estimating costs, revenues, and savings when considering selection and quality implementation of prevention programs that meet the conditions of Family First. We will also hear from real-time users of the tool from the Hawaii Department of Human Services. They will share experiences and lessons learned from their participation in piloting the fiscal analysis tool. Our speakers for this presentation are Margaret Flynn Kahn, who is a partner in Mainspring Consulting, and Rosaline Tupou, Child Welfare Program Development Administrator, the Child Welfare Services Branch of the Hawaii Department of Human Services. Let's take a minute to go over some important housekeeping details for the webinar. After we hear from our presenters, we will have some time for questions. We will keep our attendees on mute throughout the webinar, and we ask that you submit your questions by entering them in the Q&A window, which you will see circled on the slide. You'll find that window in the lower right-hand corner of your webinar screen, and please submit your questions there to the panelists throughout the presentation. If you're in full screen mode and want to ask a question, you may need to return to the event window by using the drop-down controls at the top of your screen. I will also mention that this presentation is being recorded, and the recording and slides will be available later at aecf.org. And with that, I'd like to turn it over to Margaret Flynn Kahn. Hey, Margaret.
Hi, everyone. Hi, Suzanne. Thank you. Hello, everyone. Excited to share the tool with you today, and so glad to see so many folks on the line. And as I get started, I want to acknowledge my Mainspring colleagues who worked with me in developing and piloting the guide and the tool. So it was a real team effort between myself and Kate Goggin, Lynn Teedy, and Erin Flynn Blair. And what I'll be covering is to walk you through how to use the tool to estimate costs, revenues, and savings associated with the Family First Prevention Services. And I'll try to balance as I go through some of the nitty-gritty for those who really want to download the tool and do fiscal analysis, along with some bigger picture lessons learned for those on the line who may not be number crunchers, but who want to understand some of the big picture fiscal considerations. I'll do a little bit of intro on the law, but generally we'll not be spending time going through provisions of the law in detail. We just don't have time today, but we did that on a previous webinar that's linked here. So if you need that 101, this webinar is here. There's also a summary of key provisions of the law, particularly with fiscal implications in the guide itself. So while I'm not going to spend a lot of time on the law, I do want to make sure we're all on the same page on what we're talking about here. So Family First created this opportunity for states to use 4E funds for services at home to prevent children and youth from entering foster care. And those services can be provided to candidates for foster care, and states have flexibility to define that, along with their parents and kin caregivers, and also to pregnant and parenting youth in foster care. And the services that can be supported with 4E are mental health, substance abuse prevention and treatment, and then parent education, parent training. And all of that has to be trauma-informed and evidence-based, and there's very specific requirements around what evidence-based means in the law, and a specific list of services that have been approved and that will continue to be added to. So one thing to note about the guide and the tool is that they're specific to Family First does a lot of things besides prevention services. The guide and the tool are specifically looking at the prevention services option in Family First. So this was a big shift created by the law in terms of the funding landscape for prevention. And there's a couple of things to note about that before we get into the tool. First, a lot of the attention when you hear about prevention services is on the ability for 4E to fund programming. One thing to note is that 4E has really three components of funding. There's the service reimbursement, so for the program models themselves. 4E also has a portion that's for administrative costs, so states can now do claiming for costs of case management for prevention services, for things like evaluation, for quality improvement, overall program planning under administrative. There's also a training portion where claiming can be done for training for prevention services, for child welfare staff, as well as providers, and then, of course, the services themselves. So this was a big shift, not only in making available 4E for program models, but also for all of that infrastructure that's so important to make the implementation of models effective. But, of course, there's lots of requirements in the law in terms of what 4E can and can't fund in terms of prevention services. So it's not going to be able to fund everything that states are doing for prevention or that they want to do. So there's really a task in front of states and counties in terms of thinking about what can this new 4E funding support in terms of case management and infrastructure and services, what does not meet the requirements, and then how do we pull together our various funding streams so that things that don't meet the requirements of the law can be supported through other streams like 4B that are more flexible or our state and local funds. So the guide is really aimed at helping states to do that work, and it includes, there's two pieces of the guide and the tool. So the guide has an overall summary of provisions in the law. It has considerations for estimating costs, revenues, and savings, and then it has instructions for using the tool. The tool itself is essentially 2 Excel workbooks. So one of those Excel workbooks is the summary analysis, and that is the bulk of the analysis. So that has everything from projecting the numbers, who will participate in your programs, through the costs of administration and programs, through savings. And then the second workbook are the detailed program budgets for states or counties who maybe are implementing a new service or just want to look in detail at the costs of a particular model. The detailed program budget workbook has sheets that really let you estimate in detail the cost of a single program to get down to a cost per family or per child. And then we have example spreadsheets, which is just all of those worksheets filled out just to help to guide you as you're using the tool. We piloted the tool in Hawaii and Nebraska, so you'll be hearing from Hawaii after I do some introduction to the tool. And they were at really different points in their planning when we did the pilot. So Hawaii was very much at the beginning of their Family First planning, and they used the fiscal analysis process as a means of, with their internal child welfare stakeholders, really saying, okay, if we think about some initial decisions on Family First prevention services and cost them out, then that will help to inform a broader planning process with broader community stakeholders, which they're involved in now, and you'll hear about from Rosaline. In Nebraska, they had already been through a pretty broad Family First planning process when we got started, and we really just focused on gathering the data and kind of crunching the numbers for them for what that would cost moving forward. And the implications from that are really more about informing their kind of scale up in their implementation. So I think it can be used at a variety of points in the process. And we've really designed the tool so that you can download those spreadsheets and adapt them and use them in a way that makes sense for your particular context. One thing that is sort of the starting point for this is that it's not guiding your programmatic decisions. So in other words, it really starts with an assumption that you have some definition of candidate for foster care and that you have an initial list of program models that you want to cost out. So now I'm going to move into doing a little more of a dive into the tool itself and what's included. And as I do that, we preview a couple of the spreadsheets. So just depending on the view you have in WebEx, the larger you can make these slides, the better. And I'm going to start with the estimating costs piece. So the steps that we go through in the analysis for estimating costs and that are kind of guided by the tool are beginning with a projection of your total candidates for foster care. So in Nebraska and Hawaii, we looked at what they had included in their definition. So for example, in Hawaii, they had voluntary case management, families who were part of voluntary case management, disrupted adoption and guardianships, pregnant and parenting youth in foster care. So we looked at historical data on the numbers in those different categories that were included in their definition, and then based on those numbers projected forward how many total candidates we thought there would be. And then from that total candidate number, we looked at the program models that they wanted to implement and projected how many of those candidates would be eligible for, or it would make sense to be served by those programs. And I'll talk more about that in a couple of slides, but we looked at things like risk factor data and age data for that. And then once we had an estimate of the number of candidates served by programs, then we looked at the process of what do each of those programs cost per family or child. And then finally added the administrative costs, so for case management as well as evaluation, training, and planning. And so in the tool for this, the first worksheet is focused on that process of projecting the numbers served, so going from your projection of total candidates to how many will be served by each program. And then the second worksheet looks at projecting out costs for your administrative and training. And then we have 5 program budget worksheets. You can add more if you have more than 5 programs you want to look at, or don't have to use all of those, but there's 5 in there that are identical, but that are designed for you to plug in costs for your programs. And in the summary workbook, in that program budget sheet, we're asking you for a cost per child or family. If you don't have that number, you can go to workbook 2 and do that work to develop the detailed program budget template to get to that number. And then it just summarizes it all in the total 3-year costs. So this gives you a closer look at the spreadsheet for administrative costs. And I know it's a little bit small, but I'll explain a couple of key points in how we approach the administrative piece. So all of the spreadsheets in the summary analysis are linked. So the numbers from one are getting pulled into the next. So your first spreadsheet is your projection of your numbers served in your programs. And because the law says that you can only claim the case management, the 4E for your case management for prevention services while those families are receiving evidence-based services, this sheet essentially takes the numbers served in those programs, asks for an average length of service to help to get you to what would our case management costs be for case management for prevention services, and then that number is used to estimate the revenue. And then in addition to that, so there's the case management piece, and then there's also lines for you to estimate out what would we need in terms of staffing for different administrative functions. And then you can't see it in this view, but below that it is asking for direct costs, like if you're contracting for evaluation or other costs, and then sums all of that up to get to your total administrative costs. And then for program costs, again, if you don't need to do a detailed program budget, if you already have a general sense of your cost per participant, then you don't need this. This is the detailed, I'm showing you the detailed program budget. And part of what I wanted to show you here is that one of the benefits of using this is that we've built in line items that are typical for startup for evidence-based programs. So for evidence-based programs, you're often needing to pay for initial training from a developer of the program, for materials, sometimes for licensing. So the spreadsheet builds in a lot of those startup costs. It asks you, because one challenge in the child welfare world of evidence-based programs is the high turnover rate means that you're constantly needing to spend dollars on the training. So it builds in, asks you for your rate of turnover, so it can build in those costs of ongoing training into your annual costs. And then really rolls up startup and ongoing implementation, which you can't see on this view, but is part of that detailed program budget, into a total cost per family for each year. And I think one thing that doing the pilot really got me thinking about was the startup costs. I think there's a couple of different ways that states and counties can approach the startup costs. It can be assumed that providers will get that training and bear those costs, and then the reimbursement for that can be built into what you're paying providers. Or states can really focus on building up more of a statewide infrastructure for that training and quality and fidelity monitoring and support that more centrally. And I think if you're doing significant expansion or a new program, it's probably more efficient to do that in a more centralized way across the state, and that is actually a good place for partnership with private foundation partners, with other public systems who are investing in similar programs. So I think that's an important point of consideration, and the tool helps you to kind of get clear on what those startup costs will be. Some of our lessons learned from using the tool to estimate costs. We found it helpful from the program perspective to look at a process of thinking about age range, risk factors, scale up, and uptake rates to try to get to a reasonable number of how many people you would want to serve with individual programs. So you can see on this slide the example from Hawaii. One program they included in their analysis was parent-child interaction therapy. And you can see on the first line, we estimated the total children who would be candidates for foster care based on their definition and historical data. On the next line, you can see that parent-child interaction therapy is directed to children ages 2 to 7. So again, using data that they had, we looked at what proportion of their candidates would they expect to fall into that age range. Then we looked at risk data to think about, from their risk assessment data, what would be the risk factor that would most likely make a family appropriate to receive parent-child interaction therapy. And this will look different for each state. But kind of looking across your risk data and how it's summarized for what you could pull out to estimate the proportion of your families who you'll be serving, who the risk they're experiencing would be addressed by a particular program model. So we estimated that out as well by families who have inadequate parenting skills. And then Hawaii wanted to look at a 5-year scale-up. The tool itself actually has a 3-year estimate, but we extended that to 5 years here. And so they wanted to essentially say, we're going to look at scaling up evenly over 5 years to that total number that we want to get to in 2025, that 1,562. So we built that over 5 years. And then the final piece to get to numbers served was thinking about an uptake rate. So because we're taking total candidates, total eligible population for a model, We know that not all of those will be referred and then want to participate in the service and then participate. So we came up with an uptake rate with the stakeholders that we thought was reasonable in terms of the number who would actually participate in the program. And you can see that got us down to our final number of children who would be served by the program over the 5 years. Of course, if you've already been implementing a model and you have a particular number of families served and you just want to maintain that or maybe incrementally increase that, you don't have to go through this whole process. You could use just the program budget and not the projection pieces of the analysis, but we do have that in there for those who want to go through that process. The final thing I'll say about costs is I talked about the startup. The other piece is that if you're gathering cost data from developers of program models, many of the models that are included that have been approved for Family First aren't models that are kind of exclusively developed for child welfare. So when you're looking at those costs, it's important to consider costs that may be unique to child welfare, to your context, and things like the documentation that providers will need to do if families are court involved, being involved in reports to the court, things like that. So just making sure you're building in time into your estimates of costs for the range of functions that people will have to do that are specific to child welfare. So I'll move now to talking about the revenue piece of the picture, and in some ways this is more straightforward than the costs. So for administrative and training, the federal match for 4E for the prevention services piece is 50%. So we're essentially applying that 50% match against the cost that we've included in the model. And in this model, the way it's built is we're really only including costs that are kind of eligible for 4E prevention reimbursement. And then for the program revenue side, the way it's structured in the analysis is first we look at, since 4E under the law is the payer of last resort, we look at Medicaid. So if it's a Medicaid eligible service, the spreadsheets are asking for you to include the proportion of families or children served who are eligible for Medicaid. And then it's assuming that Medicaid would pay for eligible families and the remaining costs would be covered by 4E. And then we're also looking at the maintenance of effort. And if you have maintenance of effort requirements, which is another provision in the law, if any of that maintenance of effort spending is going to be done against this program, then there's a place to include that in the revenue side. And then after we have considered Medicaid and maintenance of effort, we get in the spreadsheet to essentially your 4E billable dollars, and then we're applying that 50% federal match, which is what the match is for the first years of implementation, and then it adjusts to FMAP over time. So for some states, that federal percentage will increase over time. And so in the tool on the revenue side, the revenue is really built into those cost sheets across from worksheet 2 on the administrative and training budget. The revenues are in each of those sheets. And then in 4.3, we do a summary of state spending by level of evidence because that is a requirement of the law as well. And then we also have a sheet for you to calculate your maintenance of effort, and that pulls in the spending on maintenance of effort from across the sheets to see if you're meeting that level. So some of the lessons learned from using the tool to project revenue, as I said, under the law, 4E is the payer of last resort, and this primarily comes up with Medicaid. And so I think the question can come up, like, for example, in Hawaii, 95% of their families receiving parent-child interaction therapy, which is covered by Medicaid, were covered by Medicaid. So the question can come up, well, is it worthwhile for us to include this in our 4E prevention plan if it's primarily paid for by Medicaid anyway? And where we landed was yes. I mean, both from a programmatic perspective, that if you're wanting to have kind of a vision for how you're doing prevention, you want to include those services. But from a fiscal perspective, Medicaid can support programming for families who aren't eligible for Medicaid. And also, because families have to be participating in a program in order to draw down the case management, so the case management reimbursement from 4E, so that if families are participating in that Medicaid-covered program, you're able to draw down 4E funding for case management. Another just consideration to note is that the way maintenance of effort is structured in the law is that it's calculated based on the programs that are approved by the Title 4E clearinghouse when your state submits your 4E prevention plan. So that states, and that's a rolling target in terms of there's programs are being reviewed and will continue to be added. So I think the longer you wait to submit your prevention plan, it's more likely you'll have more maintenance of effort requirement. And the requirements for spending on well-supported programs, which in the law said that 50% of state spending had to be on well-supported programs, those have been delayed, but they're still important to consider from the beginning because you don't want to build up capacity with particular program models, in particular expectations about federal funding, and then have that decline in a couple of years when those requirements change. So I think you want to be calculating that and considering it from the beginning. And you see here the Hawaii example of parent-child interaction therapy, where they did have most costs covered by Medicaid, and then 4E covering a small proportion of that for families who weren't covered by Medicaid. So the final step that's covered in the tool is estimating savings. And our approach to this actually evolved during the course of the pilot. So we started out with a process that essentially said, look at the total number of families who are receiving programs and come up with a reasonable estimate of the proportion of those families served who won't enter foster care as a result of service. And then we calculated savings based on average placement spending against that number that would avoid care. What we found when we implemented that was there isn't, because this is new in terms of the implementation of prevention services and the tracking of data about avoiding foster care as a result, there's really not good data to inform that estimate of what proportion will avoid care. So it felt a little arbitrary, and yet I think it's really important to include some considerations of savings when you're looking at costs, because this is not just new state spending, but new state spending to help to prevent and avoid what's currently very costly out-of-home placements. So where we ended up landing is the way we approach this is really in a break-even analysis. So we're essentially saying through the analysis in the tool, you've estimated your total state spending on prevention services. And then we're asking you to look at your average placement costs, your state spending on placement. And then the analysis essentially says, how many days of out-of-home placement would you have to avoid for this to be cost neutral? And then brings that down to, you know, estimating what that means in terms of how many people would have to avoid care. So it's really calculating what you would need to avoid in terms of out-of-home placement to essentially pay for the prevention services spending. So that's the savings piece. And the final piece before I turn it over to Rosaline is I just wanted to give a couple of kind of very practical tips for using the tool. First, I would say the instructions for the spreadsheets are at the end of that PDF file in the guide. We kind of have sheet-by-sheet instructions, and I think it will just really help you to take a look at those as you're diving into the spreadsheets. The spreadsheets are structured so that they have gray shading wherever you need to actually enter information, and then other cells within them are calculating and pulling from one sheet to the other. Because we have a lot of the formulas built in, The spreadsheets are protected, so you have to just unprotect them. You don't need a password, but you do have to go and unprotect them if you want to go in and modify. And then because we have formulas built in to summarize revenue and calculate, I think that you're better off if you don't need certain things. So say, you know, as a state or county, you think we don't really estimate our administrative, we just want to focus on program costs. I think it will work better for you if you just leave things blank that you're not using than if you delete them. And the final thing I would say is I hope folks will take and use this in a way that's most helpful to them. My email was included on the introductory slide. Happy to hear from folks who have questions as they're trying to use the tool or need some guidance. Would love to hear from people, actually. So with that, I'm going to turn it over to Rosaline, who's going to talk a little bit about the pilot of the tool in Hawaii.
Thank you, Margaret. Aloha from the islands of Hawaii. I want to quickly say thank you to Suzanne Barnard and NEKC Foundation for this wonderful opportunity for Hawaii's child welfare to highlight and share our experiences in developing the fiscal analysis tool, which is a result of several months of collaboration and planning and discussion with our child welfare agency as well as our external partners and Mainspring consultants. And also wanted to say briefly that NEKC Foundation has been very supportive of our Family First, not only with a Mainspring consultant to do a fiscal analysis, but also now providing Hawaii with Alex Sidrin with the Center of Study of Social Policy, CSSP, for technical support as we move forward with developing our plan for Family First. And both organizations have worked really well with Hawaii. And also I want to say that we also partner with the other KC family programs, Kelly Sim, in supporting the development of Family First in Hawaii. Next slide, please. So we wanted to show you a geographic layout. Part of it is because we looked at the geographic locations of children and families known to child welfare. It was an important part of our discussion to know where these families are. And as you can see on this slide, Hawaii is made up of several islands. Our CWS central office is located on the island of Oahu, where the majority of our child welfare cases are. And on the bottom of the map, you see the big island of Hawaii. We have two regional child welfare offices on the west side and the east side of the island. And then Maui has one child welfare section located that covers the islands of Molokai and Lanai, and then Kauai has their own child welfare services section as well. So it was important to understand where our populations are in order to think about our plans for services. Of course, air travel is a must for placements, visitation, and even for services. Service providers often travel from Oahu to the neighbor islands to provide services. Next slide, please. Hawaii, we looked at these data. Hawaii has a statewide intake system. They receive all reports of child abuse and neglect. And looking at this data was important because all the calls or the reports that brings the families to the attention of child welfare comes through our intake. And at the intake point, there is assessment of where to send these cases. We look at this data from fiscal year 2015 to 2019, and as we can see, the intake is assigned to 3 different locations or agencies for services. All, as you can see, CWS is assigned cases of all intakes that has high risk and with safety issues. And then the other agency we divert cases to is our differential response. So we sent voluntary case management services and family strengthening services, FSS. VCM covers cases with moderate risk, and then FSS cover cases with low risk. And it was important to take a look at this because we know part of our prevention plan will cover these VCM cases, because these cases are the ones that we are trying to prevent entry into foster care by providing voluntary case management services, and it is contracted out to a provider. We also took a look at our data on why these children are reported or brought to the attention of CWS. As you can see on the data showed the precipitating factors that resulted in a confirmation of a child victim in 2019. It wasn't surprising to a lot of people, but it was a surprise to some people, but it helped Hawaii in focusing our exploration of interventions or models for Family First to address specific problems because of the data that we saw. And what we saw, as you can see, and also data that we knew from previous years, is that majority of the parents that comes to us need help with their parenting, has to do with their parenting ability and skills, followed by substance abuse and mental health. The discussion later on, where we followed up after this work with Mainspring, used this data, and it was used to determine what kind of services we would recommend for our plan. Next slide, please. We also took a look and had several discussions about the number of children in foster care, and we looked at from 2004 to 2019. And since the implementation of our differential response, we saw a drop of children entering foster care for about 8 years, and then we started to see an increase, as you can see on this slide. We also reviewed the data on children in foster care for 1 month or less, and we call them or refer to them as short stayers. And reviewing this specific set of data was very important, as we believe these children, the short stayers, perhaps should not have been removed or enter foster care at all. And it was an important discussion for planning for Family First. Next slide, please. We also took a look at these data and had several discussions about it. Hawaii has such a great mix of ethnic groups, and identifying the race and ethnicity of children in foster care, we think is a very important part of developing our programs, our Family First programs. As shown in this data, almost 45% of children in foster care are part Hawaiian or part Hawaiian. Discussion then shifted to or included the lack of evidence-based services for particular ethnic or cultural population. So Hawaii is very mindful of that, and it is concerning. And we know that although we have culturally appropriate services in Hawaii that we believe to be promising practice, yet we know there are lots of work to do to gather evidence needed to get it approved as evidence-based services. We also reviewed the age of children in foster care from 15 to 19. This was not surprising to us, as we had seen the data before. However, this data helped us as we explored Family First services, now with lots of focus on services to children and families with 0 to 5 children, and also increasing our collaborations with our early intervention and early education partners. And we also thought it was important to look at our discharge reasons data to inform us on decisions to be made for Family First services. As you can see, the majority of our children are discharged to reunification, which is wonderful. The reunification data is really important for our Family First work, because we have included the family supervision of the reunification children in our candidates definition for Family First. So the children that are reunified with their families, either with a court case or a CWS oversight case, will be part of the candidates for Family First. We also included looking at the data on adoption and legal guardianship discharge. This is because we are looking and we are including the candidates' definition of children who are adopted children and legal guardianship children who are at risk or may be at risk of being disrupted or at risk of being placed in foster care. Next slide, please. Hawaii know that or believe that our family first prevention is not something new to us. Hawaii has been doing a lot of prevention work in the past. As you can see, we did. Then we talked about it earlier. We have done and implemented our differential response in 2006 with the implementation of family strengthening services and voluntary case management. All this work is to prevent children from entering foster care, strengthen the families, and keep the children at home in their own community. We also participated in the Title IV waiver from 2015 to 2019. We implemented 4 interventions. Our intensive home-based services with home builders. We implemented a crisis response team and a safety, permanency, and well-being program and family wrap. The ones with the asterisk, the ones with the red stars, are the ones that we continue to implement. We continue even after the waiver period ended. We continue the home-based services, the crisis response team, and family wrap. Then we replace the safety, permanency, well-being with what we call now case staffing. We learn a lot from the waiver project. We learned first and foremost that it was very challenging for us to implement 4 interventions one time. So that is something that we take on to our planning for implementation of Family First. Hawaii also is such a small island that we have almost the same people that we work with during the waiver period now is working with us on our Family First planning. We learn from our experiences from the waiver project, our relationship that we have developed with others, internal and external partners during the waiver period have really prepared us for our Family First. And we really believe we're in a better position to plan and design, implement, and evaluate our Family First based on our learning from our waiver period. Next slide, please. We were so excited about the work of doing the fiscal analysis pilot with Margaret and Mainspring leading. We wanted to see a fiscal analysis of Family First and how it will impact Hawaii from a fiscal standpoint, so that decision could be made or supported to move forward with Family First. We wanted to see how the Family First would impact our outcomes of safety, permanency, and well-being of children. The work we did with Mainspring included multiple planning meetings with internal and external stakeholders. There were lots of work and coordination of meetings, in sending out flyers, invite, finding a venue for meetings that is free of charge or very minimal cost. And during these meetings, there were lively discussions in small groups and big groups, and we even put out a sign-in sheets for volunteers to join the Family First planning, exploration, and work groups. So we think this work that we did with the fiscal analysis pilot also helped us bring our community together and engage them in getting this work and moving it forward. At the end of this work, we were very excited with the fiscal tool that was provided to Hawaii. I'm already in discussion with our fiscal manager about testing out the tool and in certain intervention that we're thinking about to calculate and project the fiscal impact. Next slide, please. We started our meeting with Mainspring in October 2019, and I have to say that they actually kickstart our Family First planning, and it really helped us to move things forward. So we are very appreciative of the guidance and the structure that was provided to Hawaii, with multiple emails back and forth between CWS and Mainspring, with Mainspring providing agenda items, facilitate meetings, discussion, and all of that. We were able to move forward. We immediately started to look at our definition of candidates. We look at the services that were available to child welfare through its own contracts, services that were available through Department of Health, Department of Education, and other agencies. Mainspring helped and research and map out the evidence-based intervention services available in Hawaii, and we had small group, big group discussion about it. And in February, we had our first big community meetings. We brought in more internal and more external partners to inform them of the fiscal analysis and start developing our 4E prevention plan. Unfortunately, when COVID hits in March, we stopped the community actual face-to-face meetings with the community, but we continue to set up virtual meetings with our community partners. Next slide, please. The takeaway, I cannot say enough about the takeaways from this planning work. And I wanted to say that we could not have started our Family First without the wonderful group of these folks dedicated who are available and willing to help us. The engagement of community members, again, I cannot emphasize enough the need to engage our community members in everything that we do with child welfare. And Mainspring were very instrumental in helping us with that. We needed someone to help us facilitate our meetings, and they were there to support us. And we learned, internally, we learned more and more about Family First from these meetings as we continue to get clarification on what these Family First requirements were. And so then it provided us with confidence to move forward in developing our plan and, facilitation of our meetings. We, during these meetings, we finalized our definition of candidates, as you can see, and I'm happy to say with this work done in this initial meeting, initial planning with the Fiscal tool, we're able to use the same definition and move it forward. So we quickly move it forward now with our plan. Next slide, please. Another huge takeaway from this work is the use of the Fiscal tool. Fortunately, Mainspring completed the fiscal analysis for these 5 models. And when we moved on with the planning for our 4E plans for services, we, as of earlier this week, made recommendations that included 3 of these models, which included the home builders, multi-systemic therapy, and PCIT. So the good thing about it is the fiscal analysis is already done. We'll go back and take a look, but it's already done. And we will use the tool now to complete the fiscal analysis of 3 other recommended models, which is functional therapy, motivational interviewing, and parents as teachers. This doesn't mean we're going to implement all 6 of them one time. We learn our lesson from the waiver, so that decision hasn't been made yet. Next slide, please. The Fiscal tool also provides us the ability to input numbers of families to be served in each intervention, to be able to calculate things such as admin and training costs, and to do a 5-year summary budget, as Margaret talked about. And because it is formula-driven, we found the tool very helpful. And I have already started to meet with our Fiscal folks to start looking at using the tool and calculating the fiscal impact on us in terms of the savings and the revenues. So we appreciate this tool. It's very comprehensive. It's formula-driven. And even me, as a person who's not a fiscal person, I understand how it is used. I don't use it by myself. I normally would sit with my fiscal manager, and we would go over the tool and the numbers. And I'm from the program side, so we talk about certain things, the program requirements, and then we project the numbers, and then the tool calculate these things automatically for us, and it's really, really helpful. Next slide, please. Okay. With the work that we do with CSSP, we establish our Family First organizational structure as shown here. We have our executive team, which is made up of high-level administrators who will make the final decisions on which intervention or models to be used in our plan. and how it will be rolled out geographically or in phases. So the executive team is the final decision maker. We have an operational team that hears all the recommendations from the exploration groups. So the operational team is made up of internal and external partners. And we're happy to say that we're so excited about the participation and engagement of our partners from other government agencies as well as private agencies. Our plan is to submit our plan to ACF by October 2020 and implement our Family First services by October 2021. Thank you, everyone.
Thank you, Rosalene and Margaret, for the lessons learned and for the other considerations for use of this tool. And we especially appreciate hearing about Hawaii's experiences. So thanks again, Rosalene. Now it's time for some questions from the audience. I think we've got time for a few. And remember, you can still enter your questions in the Q&A window, and we'll try to get to as many as we can. So let's start. You just mentioned PCIT, Rosalene. Let's start with a question for you. In the Hawaii PCIT example of Medicaid and 4E funding, did you estimate, were you able to estimate the case management dollars you could tap from 4E as part of this?
I can jump in on that. This is Margaret. I don't know if Rosalene
may be on. Okay. All right, got it.
So yes, we did include part of the administrative costs, and the estimate for case management was the cost of case management. We did include that in the overall estimate, the case management that would be part of that related to the PCIT. Yep, so that was included along with the revenue for that.
Thank you. And Margaret, while I've got you, how are the states handling programs where part of the program can be billed to Medicaid, but not the total cost for the program? I think you started in on that a little bit, but are you aware of some good examples of states that do that have figured out how to bill for part of a program?
Yep, and the two pilot states we ended up landing on after consideration just including having 4E do coverage for the costs of families who weren't eligible for Medicaid as opposed to kind of partial pay, because within Medicaid there are some restrictions on having another funding source pay for the same service that Medicaid is paying for, sort of a double paying kind of restriction. Mm-hmm. Out of caution from that, we didn't assume that 4E would partially pay for a service with Medicaid. I do think there's opportunity in the infrastructure piece of this. So where Medicaid often falls short is where you have training time and where you're not getting reimbursement when people are in training and things like that. And I think if you're starting to build up infrastructure with your training dollars for 4E or your administrative dollars, that could potentially really benefit the Medicaid portion covered portion of services as well.
Thank you. Can you? I know you talked about being able to go. Margaret, this is for you. I know you talked about being able to go in and modify, but can additional line items be added to the detailed program budget? Or
yes, absolutely. Also? All the sheets in here are really, it's hard to create something generic that'll be appropriate for all, state and county contexts. So yes, we absolutely want you to go in and modify it as you need. Also, what I showed you on the slide is not the full program budget, in case you're thinking that's all there is to it. So there's another portion of it that has the program implementation costs and has line items related to that. I was just kind of highlighting the startup costs. Yes, so for the program budget sheets, all the sheets, we invite you to download those Excel workbooks and kind of take what is helpful to you and modify as you need to.
Thank you. And this is for both. I think we have Rosalene back on.
Yes.
If not, oh, good, great. for both of you, there are a couple of questions about what were the biggest stumbling blocks or obstacles, and not that it was a stumbling block, but how were external stakeholders contributing to the analysis? How, I think Rosaline mentioned that she sent out lots of messages about planning and had groups involved, but were there, so two parts of the question, were there stumbling blocks, and how did you manage external stakeholders, which has been a problem in other states, getting external stakeholders to contribute?
So I can respond maybe to the part of this. What we found is that stakeholders, the first thing I think was important is that we inform them and keep them informed, which we're doing that right now, but informing them of the vision of Family First and how it benefits the community and how they can be part of that support to the community, to the families. And then after that work, we continue to send out communication to people in the community to keep them updated on what's going on. And I think after we had several meetings, we felt that the community had understood better what we were doing and became fully supportive. And now we have people from the community who are contacting us and want to be part of this Family First and how they can support us. But I think it's engaging and being able to share the information of what we do and the vision for Family First was really important.
Thank you.
Yeah, and I would add as a kind of a challenge piece briefly. In Hawaii, I think one piece of this that's very challenging for states and that we found we didn't have quite enough time to fully address in our pilot was where you have other state agencies funding models that have been approved. So, for example, public health has been funding through, in part because of the federal investment in home visiting, a lot of the evidence-based models that are on the clearinghouse. And so then if state child welfare agencies decide to include some of those, there's this question about a coordinated funding strategy between two state agencies. And I think, to me, the question that we didn't get fully through was the existing capacity that you've built up, is it being fully utilized? So do we need to actually build more capacity with 4E and state match, or do we need to better use what you have and then getting into what state dollars versus federal that's supporting that, say, home visiting capacity that could potentially be claimed and building the structures for that? That's a really challenging area that this that Family First raises, that I think, especially in like substance abuse, is really important for states to tackle, but it will take long-term planning with your partner agencies and was a little bit beyond the scope of what the time that we had with the states who we were working with.
Thank you, Margaret. Do you know, are there states that plan on updating these projections as they move forward as implementation costs? They're better familiar with implementation costs and they've got more precise data. Do you know if there are any plans? And Rosaline, I don't know if you are at a point where you're planning to update, but is that realistic?
I would say I would encourage that. It's a tool that could be used on an ongoing basis as you get more data, and because I think this will be pretty incremental for states, how they plan and implement on Family First, and so it could be used as you move forward. But Rosaline, sorry, go ahead.
No. I was just going to say that we'll use the tool to project our implementation cost. Excuse me. And of course, we're looking at our internal general funds to fund this cost, and also looking at our FIPSA transition funds to help with implementation costs. But the tool, I think, will really help us figure that out. And we're very close. I think next month we're moving forward with that piece of the work.
Well, thank you. Thank you again, Rosaline and Margaret. We had lots of questions, lots of interest. I'm sorry we couldn't get to all of them. But that brings us to the end of today's webinar. Thank you so much for your interest and attention. As you see on this slide, you can download the tool and worksheets at the above addresses and the above address, and we hope that we've provided you at least with some ideas for how you can develop your own fiscal analysis or use the tool to do that and determine how you will select and implement prevention programs and practices. So please watch for an invitation to the third webinar in the Leading with Evidence series. It's due out in the fall. And that's the end of our presentation today. Thank you for your attendance and good afternoon, everyone.